New research shows artificial intelligence can help decrease the number of unexpected deaths in hospitals. The AI technology, called ChartWatch, operates as an early warning system that can detect which patients are at risk of deteriorating. The study's lead author, who spoke with us today, says that the technology has potential, but more research is needed.
So ChartWatch basically monitors our patients. What it does is it runs every hour on the hour. So it's an artificial intelligence solution that tracks our patients, and every hour it updates by considering typically 150 to 170 different parameters from lab values and vital signs and patient demographics. And it then predicts if somebody is going to die or go to the ICU. And as soon as it reaches a high risk threshold, it's automated to page the medical team. Our protocol at our hospital is that our medical team has to come and see the patient within 1 hour of being paged. And there are all sorts of care pathways. So, for example, do you look for signs of serious infections like sepsis and initiate antibiotics? Do you increase your monitoring and surveillance? So the medical team has to come in and decide which path they want to take. All it does is really basically flags for us patients that we need to pay more attention to fairly immediately. And we've deployed it. We've had almost 4 years of experience now. We deployed it in October of 2020, and we've been able to show a 26% reduction in an unexpected mortality. Many, actually, where our clinicians have said, okay, this really picked things up, or I may not have picked it up either as quickly or I may have missed it completely. We see quite a few instances of infections, like pretty bad sepsis, or things that could have ended up being pretty bad sepsis, among other problems as well. Yeah, I think these sorts of technologies are going to become more and more prevalent in the healthcare setting as we're looking to more and more help in terms of how do we do our jobs better, but also the complexity of data that we have is only going to get more and more cumbersome. So these technologies will help us make better decisions. It'll actually reduce the workload that we have currently. So many applications of these sorts of solutions. In terms of what to be careful about, there is a potential for AI solutions to actually not run as well as we may have thought, or even be harmful to patients. So I think a very thoughtful, methodical, careful approach to how we develop and deploy these solutions is really needed in the healthcare sector, because we do deal with very sensitive issues and processes.